Pseudomonas aeruginosa, or Pseudomonas for short, is a species of bacteria that commonly causes infections in healthcare settings. In our last video, we introduced the general characteristics and virulence factors of this bacteria. So in this scene, we're going to cover all the clinical presentations and treatments for infection with Pseudomonas. Let's get into our scene here. We're inside a mansion where an art auction is going on. Check out the centerpiece of the auction, the famous Mona Lisa. By the way, the Mona Lisa here should help you remember Pseudomonas aeruginosa. Get it? Mona Lisa for Pseudomonas aeruginosa? In this video, we are going to talk about the 4 main groups of people that get Pseudomonas infections. Let's get started. This mansion is so fancy that besides the famous Mona Lisa auction is an indoor hot tub. After the auction is done, guests are allowed to take a dip in the hot tub to relax. Anyways, the hot tub should help you remember that one of the groups at risk for Pseudomonas infections are people who are exposed to contaminated water in hot tubs or pools. So, how does an infection here clinically present? Let's find out. Let's take a look at the guy that just got out of the hot tub. Since he couldn't find his towel, he is using his hand to get water out of his ear. The man getting water out of his ear should help you remember malignant otitis externa, since this condition is just a fancy term for a bad outer ear infection. Malignant otitis externa, or MOE for short, is a classic clinical presentation of people who are exposed to Pseudomonas through contaminated water. As a severe outer ear infection, it should make sense that patients will present with severe ear pain and drainage. If left untreated, this infection can progress to cause osteomyelitis of the nearby skull. Next, check out that big rash on this guy's back. The water in the hot tub must have been too hot, leaving him with a pretty red rash. The red rash from the hot tub should remind you of hot tub folliculitis, another clinical presentation of patients exposed to Pseudomonas through contaminated hot tubs or pools. In fact, this relationship is so common that this rash is even called hot tub folliculitis. This is basically just an infection of the hair follicles that are exposed to the contaminated water. Usually, patients will come in with an itchy papulopustular or acne-like rash over their trunk and extremities. Let's move on to our next group of people affected by Pseudomonas. To help keep the hot tub water clean, there is a drain taking out the dirty water. Actually, there looks to be some green goop in the drain. The owners here clearly have to clean out the algae because that stuff looks pretty thick. Anyways, the green goop obstructing the pipes here is our recurring symbol for cystic fibrosis, since cystic fibrosis is characterized by buildup of mucus in the airways of the lungs. The second group of people that Pseudomonas aeruginosa can affect is patients with cystic fibrosis. Let's keep exploring this mansion to find out how exactly Pseudomonas affects these patients. Take a look at this older lady who is relaxing next to the Mona Lisa. Looks like the smell from the dirty pipes of the hot tub has wafted over, causing our lady here to cough. The old lady coughing should help you remember pneumonia, since one of the classic symptoms of a lung infection is coughing. Patients with cystic fibrosis usually present with pneumonia after infection with Pseudomonas. This happens in these patients because the increased viscosity or thickness of the airway mucus in patients with cystic fibrosis impairs the mucociliary escalator's ability to clear away bacteria like Pseudomonas. Also, because of the inability to clear away the bacteria, recurrent respiratory infections with Pseudomonas aeruginosa are common. You are probably sensing a pattern here. Pseudomonas aeruginosa seems to do well in warm, moist environments. Keeping that in mind can help you remember the bacteria's connection to hot tubs and patients with cystic fibrosis. Let's take a closer look at the older lady to find out another set of patients who are vulnerable to Pseudomonas aeruginosa. Let's go back to the pool, where we can see a pile of clothes belonging to a person in the hot tub. And as you might expect from people at an auction, this person's got a cane, since I associate art auctions with refined, older people who use canes, right? Well, this cane is doubly helpful because it helps us remember immunocompromised patients. You know, since a cane is used when you are too weak to support yourself, just like immunocompromised patients have weak immune systems. Immunocompromised patients are the third group of people at risk for Pseudomonas infections. This usually affects people with low neutrophil counts, like those who undergo chemotherapy or bone marrow transplants. So, how do these patients present? Ew! This hot tub drain has not been cleaned for a while, since there is some black mold growing on its walls. Looks like this hot tub drain really needs a nice clean to get rid of this mold. This spreading black mold should help you remember ecthyma gangrenosum, since the lesions caused by this condition create a black skin lesion that looks like the black mold. In immunocompromised patients, a Pseudomonas infection can lead to ecthyma gangrenosum, a rapidly progressive necrotic infection of the skin. The affected skin turns black and necrotic because the invasion of Pseudomonas destroys blood vessels supplying the region, leading to tissue death. This is a pretty severe medical problem. It's quite likely you'll see patients with ecthyma gangrenosum in the ICU. Now, let's talk about the fourth and final group of people that are affected by Pseudomonas aeruginosa. As if the hot tub isn't dirty enough, it looks like the guy who came out of this tub is now peeing near it. He must have had to pee immediately and couldn't reach the bathroom. Well, anyways, the urinating here should remind you of a urinary catheter and a urinary tract infection. You know, since these are all related to the urinary tract. Pseudomonas aeruginosa can infect patients who have an indwelling urinary catheter, also known as a Foley catheter. This is basically a tube inserted into the bladder to help drain urine in patients who are unable to urinate appropriately themselves. Specifically, a Pseudomonas infection here results in a UTI, or urinary tract infection. This type of infection is extremely common to see in the healthcare setting, since a ton of patients in the hospital have indwelling catheters. Okay, let's close out by talking through some treatment options. Remember the old lady coughing pretty hard from earlier? Well, she is coughing also in part due to that pipe she keeps smoking from. Anyways, the pipe here should help you remember piperacillin. Piperacillin is an extended-spectrum penicillin that is specifically designed to cover Pseudomonas, making it an anti-pseudomonal penicillin drug. Pretty neat, huh? Check out this roll of tickets next to our lady here. You know how auctions always have tickets for entry so they know who the bidders are? The tickets should help you remember ticarcillin. Get it? Tickets for ticarcillin, since they sound alike. Ticarcillin is another anti-pseudomonal penicillin drug that can be used for treatment. On top of the table, there seems to be some small refreshments for the guests, like this pimento cheese dip. By the way, the pimento here should help you remember cefepime. Get it? Pimento for cefepime. Cefepime is a fourth-generation cephalosporin drug with good activity against Pseudomonas. There's actually another cephalosporin that is also used. Let's talk about that next. Check out the security guard standing near the hot tub. He is walking with a taser to confront the man who is peeing in public. The taser should help you remember ceftazidime. Get it? Taser for ceftazidime. Another treatment option for Pseudomonas aeruginosa is ceftazidime. Ceftazidime is a third-generation cephalosporin drug with activity against Pseudomonas. Note that while the cephalosporins cefepime and ceftazidime are effective against Pseudomonas, ceftriaxone is not effective against Pseudomonas. Next, check out that beautiful flower centerpiece on the refreshments table. You may remember that flowers are a recurring symbol for fluoroquinolones. Get it? Flowers for fluoroquinolones? Fluoroquinolones like levofloxacin and moxifloxacin are another treatment option for Pseudomonas infections. Finally, beside the Mona Lisa is an expensive collector's postcard from Panama. By the way, Panama here should help you remember carbapenems. Get it? Panama for carbapenems? Carbapenems like meropenem and imipenem are newer beta-lactam drugs that are used as last resorts for Pseudomonas infections unresponsive to the other drugs we mentioned. I know this seems like a lot of drugs, but there's a reason for this. You see, Pseudomonas has acquired a lot of drug resistance to antibiotics over the past few decades, leading to an evolving standard of care and new drugs created to target the bacteria. Right now, the standard of care for most Pseudomonas infections is piperacillin or ticarcillin, but this may change in the years ahead. All right, that's it for the clinical presentations and treatments of Pseudomonas. Let's summarize. Pseudomonas aeruginosa is a bacteria that tends to infect 4 groups of people. The first group is people who have been exposed to contaminated water from hot tubs or pools. In these patients, Pseudomonas aeruginosa can cause malignant otitis externa, a severe outer ear infection, as well as a rash affecting the hair follicles of the skin, colloquially known as hot tub folliculitis. The second group of patients infected by Pseudomonas are those with cystic fibrosis. Pseudomonas typically presents in these patients as pneumonia. The third group of people affected are immunocompromised patients. These patients can develop a severe necrotic skin disease known as ecthyma gangrenosum. The fourth and final group of people affected are those with an indwelling urinary or Foley catheter, in which an infection with Pseudomonas presents as a urinary tract infection. The treatments for Pseudomonas infections are many and are constantly evolving. Currently, the first-line standard of care for severe infections are anti-pseudomonal penicillins like piperacillin and ticarcillin. Other options include the fourth-generation cephalosporin cefepime, the third-generation cephalosporin ceftazidime, fluoroquinolones, and carbapenems. Okay, now we're finally done. I'm going to try my hand at buying a masterpiece. Might make a nice addition to the decor of my study room. I'll see you in the next one.